respected chairman, college secretary, respected principal, College of Nursing, respected Tamil Nadu Nursing Council Registrar, my dear staff nurses, nursing students, welcome to this CNE meeting of 6th National Conference. I am really glad to stand to give the speech in the inaugural session of 6th National Conference. I should be more thankful to this college who has selected me as a chief guest in this occasion. I am really glad to stand. And also, I welcome all the speakers of CNA meeting. Mrs. Gladius Madam, HOD, Mental Health Nursing, ES College of Nursing. Professor Jayasri, HOD, Mental Health Nursing, Mother Teresa, Postgraduate and Research Institute, Puducherry. Professor Sri Lata, HOD, Mental Health Nursing, AECS, Maruti College of Nursing, Bengaluru. Professor Mrs. Puducherry, Speaker, Principal, ES College of Nursing, Villupuram. Mrs. Bharani, Assistant Professor, HOD, Department of Psychology, Theivanai Ammal, College of Women, Villupuram. Dr. Puducherry, Associate Professor, Department of Psychiatry, Government Villupuram Medical College Hospital, Villupuram. And Professor Mrs. Smita, HOD, Mental Health Nursing, Narayana College of Nursing, Nellore, Andhra Pradesh. This 6th National Conference in ES College is very tough to conduct this national conference. It is not an easy way to organize each and every person from various destinations, and arranging this meeting is so tedious. So I should give a special thanks to the College of Nursing, ES, Madam Puducherry, Madam, here in this occasion. So arranging speakers, arranging the special guest, informing to all institutes through online and offline, sending the invitations, and arranging infrastructures to execute the conference is very, very tough in this situation. But anyway, she has done a successful commitment of all works today. And along with the HOD Department of Psychiatry, Madam Gladius helped her in such a good way. Along with the team, it is successful actually. Studying in ES College of Nursing is very, very, to say you're all lucky by studying in ES College of Nursing. It is a big organization. When you compare with other colleges, it's a very big organization in Villupuram. Even all over the state wide, it is a big institutions that you are studying here. And in my experience, I should say that your ES College of Nursing students used to come to my destination, Institute of Mental Health, Chennai, along with faculties. So those faculties really guide them well. And students also very much interested to see the case and to do the nursing care and intervention for mentally ill patients in my hospital. So from morning to evening, the faculties are staying with the students in my hospital, in my destination. So they guide the students well. Students are very much interested to commit their various patient-related activities in the respected posted wards. So I am really happy about these students because I handle nearly 110 colleges from all over the state in my department. Among them, the ES college maintained their discipline, maintained their dignity, and really, they are very punctual in time. They come in time in morning, and they used to go in the afternoon. Meanwhile, they take classes and all those things they complete in my destination, IMH. So I am really happy about delivering this important message to you. Though the nursing students are very tough to study this subject financially, family-wise, they faced a lot of problems. But even though they didn't show anything in their education, because this is nursing profession, they don't show their sufferings. They show only happiness always. So in that aspect, this ES College of Nursing is very fantastic organizations to study and to continue study here. I appreciate all in this occasion. And conducting this CNE program in these days, it is very, very tough because this is purely with a lot of professionalism. So to cope up with all demands, according to the Tamil Nadu Nursing Council, it is very tough. But your principal conducted successfully here to educate the nurses, to increase the quality of nursing profession. So you are all coming here to attend this with so much of eager. You are going to attend this meeting, attend this session, teaching session till evening. So in my opinion, nurses' demand is heavy in national and international wide. Understand that? So the cultivation of nursing student is very important with a high quality. So that's what I feel now here. So nurses' demand is actually very, very heavy. The Indian government has such a very good plan to execute the increasing the number of nursing staff in India. Actually, in India, there should be a 43 lakh of nurses we need, according to the Indian government. But actually, existed number of nurses are only 33 lakhs and 41,000 nurses. In order to compensate the heavy number of less, to compensate that, the Indian government has decided to start nearly 157 new nursing colleges all over the India. That's the information you should know. Among them, 157, nearly 11 colleges in Tamil Nadu state by the government. In statewide, actually, the nursing colleges and nursing institutes are nearly 360 nursing colleges and a yearly output of more than 20,000 nurses in Tamil Nadu state, which is not enough actually. There's an acute shortage of nurses. Understand that? So, according to the WHO, they recommend, and also the International Council of Nurses also recommended to the Indian government to start new institutions. Currently, the census says nearly 1.93 nurses for the 1,000 population. It is existed now. It is existed. But actually, WHO recommendation is 3 nurses for 1,000 population. So actually what I want to say is the nurses' demand is in high level. Once you finish your job, education, immediately you may get the job wherever, national and international wide. So that's what I said. You study with a higher quality of nursing. Your teachers are ready to teach you, to mold you. But only thing is the students should be ready. Not only students, but also the nurses, those who are sitting here only with a BSc or only with a diploma, they should get more education by studying post-BSc and MSc. Your jobs are heavily wanted. And another important information, it's a very big milestone, very important message for everyone, not only for the students, is actually, I think you might have heard about it. The Indian Nursing Council, that you know, the name is very old. From 1947, the Indian Nursing Act comes. That act is replaced recently, just 2-3 days back, by NNMC. The INC name is replaced by NNMC, that is National Nursing and Midwifery Commission. Just 3 days back, 28th, in the Cabinet of India, the Government of India submitted the bill of NNMC, National Nursing and Midwifery Commission, on 24th in the Cabinet, and which was passed into 28th. The bill sanctioned and new act comes. The INC, the name replaced with the NNMC, National Nursing and Midwifery Commission. Same like Indian Medical Council is also replaced with National Medical Commission. So in this situation, you should know about it, because this is just 2 days back. This is a fresh news, hot news for the nurses after 70 years of freedom. So everyone should know that. So why we need NNMC, National Nursing and Midwifery Commission, means they give freedom and autonomous for the nurses. Especially, they started to give new nurse practitioner, nurse specialist, and advanced nurse practitioners. So they want to give separate coaching and training for nurses, those who have completed the basic courses. Understand that? So further, they conduct the practical and theory exams that nurses can do the practice. And the proposal has been submitted to the National Medical Commission and also in the Rajya Sabha and Lok Sabha. It has been sanctioned. Actually. The nurse can do the practice. The nurse can prescribe certain amount of drugs, certain level of drugs. A nurse can do the invasive procedures with the help of senior surgeons in future. So that's what the NNMC is created to give better education for nurses and autonomy for the nurses. So it is a great news and hard news for nurses in these days. So I am really happy that you are studying here, and you should become a nurse practitioner, an advanced nurse practitioner and clinical nurse specialist in future. I hope so. So nurses, to change the entire nurses' view, the NNMC is started. So you should know about it in this occasion. That's a special message for you. And also wherever I go, at the time of interview by the FM radio or in the TV, I used to give an interview to the entire public about nurses should have a separate directorate. So I have given the news to every news channel. So we should have a separate directorate in Tamil Nadu state, and also we should have a separate nursing university in our Tamil Nadu state. All the proposals are ready, and it is in the government table, So in future, we will get the directorate separately, we will get the university separately, and everything. So that's an important message for you in this occasion, and I appreciate this program to continue in this day evening. So I'm really happy about talking to you. I thank you so much for the entire organization of ES College of Nursing, ES staff, faculties, and each and everyone. Thank you so much.